Hi.
Morning. Good morning, people. How are you today?
Hola, profe. Está helado.
Hello, Juan. It's cold, John. Yes, cold and sleepy. But here we are again. Well, next week we got a recess week, right? So this is pretty much like the in this case the last class before the deadline for the in this case the for and against essay. Um, if there are any questions about the essay, uh, any in this case any doubt about maybe the format, APA standards, um, anything that you'd like to ask me about. Um, I've seen that you've been sending me your in this case your essays through Google Drive. Remember to share it with me and also Ivana so that we can start the correction from Saturday. Then we can start from Saturday. Now, if there is somebody who needs an extension, I can give you until Sunday midnight. Okay, that would be Sunday 13th, I guess. And check, yeah, Sunday 13th until midnight could be used as an extension in this case. So in that case, I could start correcting from Monday. Also, we should start studying unit number 3. Or we should have started unit number 3 regarding, in this case, health and lifestyles together with, or in this case, more grammar issues like past perfect continuous, etc., etc. Right. So if there are no questions regarding the essay, we should continue with unit number 3, the new contents. At the end of unit number 3, we're going to have our applied grammar test, which is basically, in this case, a quiz, kind of long, but it's going to be a quiz on UCampus using the tool Evaluaciones. I think that's the name given in the. Let me share with you. Let me share with you my screen. there is no test. Sí, tests. Se llama tests. So at the end of Unit 3 and at the end of the semester, you're gonna be using this one with, and there will be like a lot of questions regarding the grammar of the semester, right? I haven't added the test yet, of course, because it's gonna be at the end of July in this case. All right. Regarding in this case Unit 3, you can see that the metalinguistic contents will be about past perfect continuous, used to, be used to, and get used to, which is not here, but we're going to study get used to. Must for deduction, report speech, yes, no questions, expressions of time, and report speech. And the lexis is related to illness, disease, and injuries, treatment, and alternative medicine. Tamara, dígame, what is your question?
Hola, profe. Buenos días. ¿Va a
Uh,
entrar el vocabulario que ha enviado todo este semestre? ¿O no?
yes, all
Ok,
the vocabulary and the grammar items for this term.
ok, gracias.
You're welcome. Of course, we're going to have, in this case, a review about pretty much everything related to the vocabulary and the grammar, right? I think we're gonna be studying pretty much like before, right? Let me see something here. I'm gonna show you the calendar. So here, the third assessment is scheduled for this case that for this week, which is from the 19th to the 23rd of July. So and before there's a week, okay? So I think we're gonna be in this case revising and reviewing the whole in this case metalinguistic repertoire, like this week, you know, from the 5th to the 9th of July. So we should be finishing, I suppose, in this case the revision of the content. We should be finishing studying pretty much the metalinguistic contents this week, which is the first week of July, but debería ser como el 1 de julio, ¿no? Dice que el 28th es holiday. Ah, sí, ¿verdad que hay un holiday aquí en junio? En finales, a ver. Junio, sí, ese fin de semana largo. 26th, 27th, 28th. We got in this case, a long weekend. Entonces debiéramos estar finalizando los contenidos en su totalidad el 1 de julio, 1st of July. So we got, in this case, pretty much next week is recess week. Igual voy a subir contenidos asincrónicos, ¿ya? Y después vendría recess y después tendríamos la semana del 21 hasta el 25 y después 29, 30, primero para poder pasar contenido. Which is, in this case, not so much because we already started, I think. Creo que ya empezamos ya el Unit 3. No me acuerdo si fue con ustedes o con la otra sección, pero anyway, partamos primero por lo básico de Unit 3, que sería el lexical content, which is about health, diseases, injuries, and so on. I already uploaded three presentations about the metalinguistic contents, right? which are here in the content section. And it's pretty much vocabulary and grammar structures. Also, we got the which is Murphy-Raymond English vocabulary in use, pre-intermediate, so that we can check out the contents in here. You did some 455, something like 5445. We're gonna check immediately. Su conexión es instable. Oh, bastante. Voy a desactivar la cámara un poco ya porque tengo el internet bajo. Me avisan si me lagueo, por favor. Yeah. So let me show you the unit, which is around here. Yeah, 54 and 55. Esas eran las unidades. Health, illness, and disease, health injuries. So here we go. Here we go. Here we go. I'm gonna use a view in this case because sometimes it takes too long for the previous view. In this case, should be working faster. Come on. Come on, come on. Veamos. Y está cargo parece. Todavía está cargando, parece. Bueno, mientras carga, let's study from here. There's a lot of, in this case, vocabulary that we should be studying. Of course, I'm not gonna include pretty much everything in the test. You know, I'm gonna be selecting some vocabulary in general from every unit. But in this case, I'm gonna revise quickly some vocabulary regarding health and medicine. For example, we got accident, ambulance, aspirin, bandage, bleed, blood pressure, bone, broken, bruise, burn, cancer, cavity, checkup, clinic, cold, contagious, cough, dentist, diabetes, diet, disease, doctor, emergency, exercise, fever, first aid, flu, headache, heart attack, home remedy, illness, infection, insomnia, insurance, medical, nurse, operation, operate, overweight, pain, patient, phobia, pill, prescription, relax, runny nose, sneeze, sore, sickness, sprain, stitches, stomachache, stress, sunburn, temperature, toothache, underweight, virus, and vitamin. Now, from this list, maybe we can, in this case, highlight some vocabulary which is not very well known. For example, from this column, in this case, it's pretty much like very similar to a wound, but it's a moretón, basically. It's a bruise, right? We also have a cavity, which is pretty much like the when one of your teeth, a tooth starts to ache. In this case, normally tooth aches, they come from cavities, you know, caries. What else from the second column? Maybe kind of a difficult word might be disease, which is more in this case technical. A disease is a sickness caused by health, in this case professionals. Also in papers and stuff like that. What else from the next column? One word which might be in this case maybe less known or interesting could be prescription, which is the document, the certificate that a doctor gives you with the medicine, with a specific in this case medicine, and that you should get from the pharmacy, for example. What else? Home remedy. Interesting. Is pretty much anything that could be prepared as in this case medicine, but which is not from the big pharma. It is maybe like some secret medicine from Amachi, or something which is a tradition, like a cultural tradition. Many times they don't work, but many times they work. So the typical, for example, chicken soup, to in this case help your body to intake some food when you can't normally eat. Like the typical chicken soup is considered a home remedy, which might be effective. Not to cure diseases, but in this case to strengthen the body, and at the same time the immune system. What else? The infection. The rest is kind of, I think, an insurance. I think it's something which is kind of important in the social and political sense, because each normally are products created by companies in this case that can provide healthcare, paid healthcare, but also we should be talking about maybe state insurances for everybody, like a public, in this case, a public service. Like for NASA, for example, it's not precisely an insurance, but it should be providing for free healthcare for everybody. And insurances are seguros. You can have health insurance, you can have life insurances, or other types of insurances, right? Insurances in seguro, but could be in this case applied also in the healthcare area, right? Normally in Chile, in our country, they are paid by, in this case, the contributor, or sometimes by companies. I mean the employers. Medical insurance is the combination of words in this case. And from the last column, I should highlight maybe sprain, which is torcido. Maybe a sprained ankle, a sprain in this case a wrist, como muñeca, and so on. La torcedura. Stitches in this case son los puntos que le llaman, ¿cierto? Stitches are in this case every in this case point in which the doctor sews the skin or the tissues. What else? Stomachache. The rest I think you already know what that means. Sunburn is the situation when you go to the beach and you, I don't know, fall asleep on the sand, and then you got your whole body burnt basically.
Profe,
Dígame.
¿y runny nose qué significa?
Good question. Especially when you got a cold, you got the fluids coming out of your nose. So es una nariz moquillenta. That's basically.
Ya, profe, gracias.
No problem. Sneeze. Do you know the meaning of sneeze, guys?
Estornudo.
Yeah, very good. Excellent. And what about sore? For example, sore throat, sore legs.
Es
You
inflamado.
understand? Excellent. Very good. So you may have sore eyes, sore anything, which is inflamado or inflamada. Very good. Excellent. If there are no more questions about the vocabulary in general here, we can continue with the next slide. So let's
Profe,
move on. Dígame.
disculpe, creo que dijo el significado de first aid, pero no lo escuché.
El first aid kit, for example, los primeros auxilios.
Ok, gracias.
No problem, no problem. More questions?
Underweight.
Check up. Underweight, yes. Tenemos overweight and underweight. Sobrepeso y está bajo el peso, digamos, promedio.
Thanks.
You're welcome. Checkup is pretty much like the first check that a patient
Okay.
might have. Yes.
¿Cómo se dice quirófano?
Operation room.
¿No
Or
tiene
surgery room.
ningún otro nombre así como nada?
Claro, lo que pasa es que en ese caso el origen, la raíz es distinta, en este caso de lo anglosajón. Siempre es operation room, or surgery room, but you can look it up if you want. If you got the OR, exactly, the OR. Es como el emergency room, que es ER, ¿cierto?
Ya, sí. Ok, vale.
No problem. You're talking with someone who watched Grey's Anatomy like 3 times. Just that matter. So I guess a lot of vocabulary, maybe more than me.
Maybe, I don't know.
Yeah, I used to watch, for example, Grey's Anatomy. I just know something, but I used to watch The Good Doctor a little bit, also Dr. House, but the one that I watched the most was this one with Dr. Woodward. What is the name? La serie está Amsterdam, the New Amsterdam on Netflix. I pretty much watched everything, and really good series, all of them. So if you like, like this hospitals and medicine series, maybe it's going to be kind of interesting, this stuff for you. So we got here more infographies in this case, or Pictionaries. For example, there is like more technical things in like in detail. So you can see here like a prescription here, or an injection or shot. Then the band-aids or bandages, sometimes called las curitas. Parche curita we say, but in English is band-aids. Also number 4, you can see here stitches, images of the stitches, los puntos. Number 5, you can see a sling, which is pretty much el cabestrillo. The crutches when somebody is, in this case, have an accident, like a broken leg and stuff like that. Also in number 8, a diet, especially when you got like problems with your stomach, with the weight, gastritis, for example. Normally doctors, they consider a diet for patients. Number 9 in this case is the typical, rest in bed, take your medicine, drink a lot of water, drink fluids. And number 10, 11 in this case is exercise, which is part of a treatment many times. And also 12 is the gargles, la gárgaras with medicine sometimes for your throat. And in this case, 13 is X-rays, when you want to detect maybe some problems inside with your bone. And 14 is doing tests, in this case, like effort tests or different types of, in this case, cardiograms or different types of, in this case, measures of the vital signals in your body. And what else? Blood work in this case, or blood tests, when you get extracted some blood from your body. Surgery, which is 16 in this case, la operación, ¿cierto? Physical therapy, like in this case, with chiropractors or occupational therapists. 18 is counseling, which is pretty much coming from psychologists and psychiatrists. And what else? I'm going to be reading the chat in this case. No dice la Tania. What else? The hospital bed, which is, of course, different from regular beds, hospital beds. Call button, o el botón de pánico, right here. Control, which is in 21 here, to adjust, the angle of the bed. Number 22, which is here, the IV, la intravenosa. What else? The hospital gown, which is la bata. Bed table right here. Bed pan to do your, in this case, basic, you know what I'm talking about, to pee, basically. And the medical chart with the report and in this case, the figures, and so on. A lot of different specific vocabulary. Of course, I'm not going to be including everything in the test, so just us. And actually, if I include something, it's going to be part of a contextual, thing. No le voy a preguntar así como, ¿qué significa gargle? No, va a estar dentro de una oración o dentro de un párrafo. What else? Structure. Now we're going to be studying a little bit more of structure. For example, for conversations with the doctor and stuff like that, we got vocabulary and functions that we can, in this case, learn. Typical questions like, how do you feel? How are you today? How are you? How do you feel today? And then the answer should be, in this case, I feel fine, feel good, feel great and fantastic. So in that case, it's like, okay, what are you doing here? Just go home. Or if you say, I feel sick, I feel awful, I feel terrible or miserable, in that case, like, what's the matter, might say the doctor. I have a headache, for example, or I have migraines, como migrañas, I have migraines. Like, sorry to hear that, how long have you had these migraines? And then you start talking to the doctor about your problems, your issues. Also, you got, for example, I'm sick, estoy enfermo, I feel sick, which is the same. No, I'm not so good, not very well, etc. When you hear or see that someone is not well, then you can ask, what's the matter? Like, more specifically, what's wrong? Tell me about your symptoms. I have, plus the health problem in this case. I've got, which is British in this case. I have a sore throat, and then you start describing the symptoms. I have a backache. I have a broken leg, for example. I have a fever. So some of this, you know, in this case, can be indicators of a disease, you know, because sore throat is pretty much like a symptom, earache is a symptom, fever is a symptom, a cough is a symptom, headache, heartburns can be symptoms to something else, you know. Right. Well, of course, when you say I've got asthma, is pretty much like a diagnostic, you know. That's the health issue, that's the disease, you know. Asthma, a broken leg is also, you know, the diagnostic. A cold is, you know, provoked by viruses. The flu is pretty much the same, like a virus, which is worse than a cold, of course, and COVID is worse than the flu. Way worse, of course. You can die. Well, some people die in this case from flu, but it's because they don't receive the treatment, you know. But COVID is way, 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 way worse. What else? A rash can be a symptom, for example, to something else. For example, like an allergic reaction. The measles, you know, la peste, this case. That's a diagnostic, basically. What else? Sore throat is a symptom. Stomachache is a symptom. Sunburn is pretty much like the consequence of you not using sunblock. And toothache can be a symptom of a cavity or an infection, and so on. So phrasal verbs related to illness in this case. I would like somebody else to read. You know, I don't want to read everything in this case. So let me find somebody in the class. Maybe in this case, Danai. Are you there, Danai? Danai Sierra? Can you hear me? Are you sleeping, Danai? Right. Maybe. Bien, excellent.
No podía
Yeah.
activar el micrófono, lo siento.
It's okay. All right. Can you help us, please, here? All of them?
Okay.
Thanks.
Come down with something. To get an illness that is not very serious, I'm coming down with a cold. I keep sneezing and I have a runny nose. Profe, ¿le puedo hacer un poquito de zoom?
Yes, of course. Give me 1 second. Vamos a hacerle más zoom aquí. Maybe now. Creo que le hice demasiado. Bueno, mal lado, espérate. Voy a moverlo para allá. Ahí. There you go.
I see. Get over something to return to one's usual state of health after an illness. Seth got over the flu. He's feeling fine now. Fight something off to avoid getting sick, to free oneself from an illness. I thought I was getting a cold, but I fought it off. I got barely of rest yesterday, and today I feel fine. Breakout in
Hives.
hives are
Mhm.
a rush to suddenly begin to sweat or develop a rash, etc., on your skin. Grace often breaks out in hives when she gets the flu.
Thank you very much, Danai. Thanks a lot. So guys, I would like to show you the hives in a rush so that you can check out the difference, right? I hope you're not in this case so scrupulous. Okay, this one, for example. These are hives. Let me tell you a little story. Let me tell you a sad story. It's not for you to be, in this case, afraid of the vaccines, but I didn't know that I had an allergy, like a previous allergy. But now I know, you know, when I got the, in this case, the Sinovac, my whole body broke out in hives, my whole body. And I didn't know that I was allergic to something. So when I went to the, in this case, the emergency room in my pool, I discovered, and they told me that I had an allergy, and I told them, well, yesterday I got the Sinovac, but today I ate, for example, like some seeds and grains together with more things. And the doctor told me, yeah, maybe it's not exactly the vaccine, but talking to another health specialist, he told me that maybe it was not exactly the vaccine, but after I got the first shot of the Sinovac, my immune system was really sensitive, like extra sensitive, you know, like fighting and defending, you know, my body from any allergen or any you know, strange body, you know, inside. So when I ate something the next day, uh, my body reacted to maybe some food or grains or seeds. So in this case, I just exploded. You know, I broke out in hives, and also was a kind of an anaphylactic reaction. You know, it's called anaphylaxia, and I had to receive adrenaline, like a couple of shots of adrenaline, so that, and betametasona. So in this case, my body would start or antihistaminic, you know, uh, so that I can, in this case, recover normality. You know, like this, for example, I was like this, but my whole body, you know, my back, everything, every part of my body had these hives, which was not really nice, of course. That's a real story. And also rashes, for example, are kind a little different, but they look similar. For example, I remember that my daughter is, maybe it's something which is inherited, you know, it's part of the family, you know. She started to be like this, you know, like this guy, when she ate in this case wheat some years ago. But it's pretty much like the wheat in combination to other elements. But now she's doing much better. Maybe it was like the first reaction to what we call the semela, because semela is made of trigo candel. So maybe she didn't, the body considered that ingredient as something in this case dangerous, but now it's not so strong. But she had to follow a treatment, of course. And now she had allergies. She has to take in this case desloratadina every day for, I guess, for the rest of her life, unless her body may, in this case, you know, get more stable. or her immune system in this case. So yeah, these are rashes. You can see that the difference from hives, hives are more, in this case, they look like bumpy, but the rashes are different in this case. That's a rash in a little baby, for example. So it's a normal reaction anyway, a normal reaction of the body as a, in this case, defense, or showing that it's fighting against something. Oh, this is way worse in this case. So terrible. Anyway, if you suffer from rashes and hives sometimes, like I totally understand you guys. What else? We can check out here some more vocabulary. We still got 8 minutes to end the class. For example, you can see some medical practitioners here: surgeons, paramedics, psychologists, nurses, ENT doctors. In this case, it's a special, in this case, specialization. In this case, hold on. The what we call the los oculistas, no, el otorrino, perdón. Otorhinolaryngology, otorhinolaryngologists. That's the word. It's not the, in this case, the oculist. It's otorhinolaryngologists. It's kind of a difficult word. It's not easy, especially regarding this area of health. It's very technical, very technical. That's the ENT doctor. What else? Pharmacist, consulting doctor, attending doctor. In this case, they are doctors, but it's pretty much like the function, which is different, duty doctor, in this case, which it's the one that is maybe in the hospital, like in this case, doing a shift. The consulting doctor is pretty much the one that you may call. The attending doctor is pretty much the one that in the ER maybe, but not in the office, is in the emergency room, for example. Family doctors, el doctor de cabecera, veterinarian, and the dentist. Of course, there are many more specialists, but they are like hundreds. So we're not going to be dealing with all of them. It's too much. And also here, we can see like different practice, in this case, with the conversation. And I think it could be interesting to practice, being, in this case, examined, like doing a role play and stuff like that. But the problem is that I don't see the tool to share, in this case, no, to create rooms. That we can create extra. Here, yeah. Aquí puedo crear salas. Excelente. No he dicho nada. All right. Let me see cómo estamos de tiempo. What time is it? 5 minutes. Yeah, we have time. So what I'm going to do is the following. I'm going to create rooms. We are, in this case, 13 participants. So I'm gonna in this case, distribute you as groups. And the idea is that you're gonna practice a conversation. Yeah, like dialogues, like a dialogue. One of you is gonna be the doctor, and the other person, or maybe two people, are gonna be patients. All right. So the idea is that you also can check out the, in this case, the presentation. You can use this one, of course, this slide and this dialogues, or you can create one of your own, no problem. Okay, so we're going to start in this. I'm going to start creating the rooms right now. And then I'm going to start sending you to the different rooms, okay? hold on. I'm gonna do this very quickly because otherwise se nos va a acabar el tiempo. Time is running out. Group 2, we are 13 people. No, yeah, 13 people. So yeah, group 2. Group 3. Group 4. Okay, 4 groups of 3 people. So one of you have to take turns. 2 of you are going to be patients, and one of you guys are going to be doctors, and then you have to switch if we got time, right? Okay. Let me see. Alejandra Malverde, group 1. Benjamin, group 1. Catalina, group 1. Constance, Danai, group 2. Yeah, group 2. Javier, group 2. Pia, group 3. Tamara, group 3. Tania, group 3. And Tomas, group 4. Vicente, group 4. And I'm going to be checking your performance in this case. Traten de hacerlo bien natural nomás, ¿cierto? Traten to try to do something which is a kind of a natural conversation, okay? Doctor, patient, and stuff like that. What you have to do is to click on the breakout rooms and then just go to the group that I just assigned you, okay? Alejandra Malverde, group 1. In this case, Samuel goes to group 4 in this case. No, Samuel creo que ya lo asignó. Samuel goes to group 4. Yeah. Danai Sierra goes to group 2. Tamara Vilches goes to group 3. And group 4 is Samuel Tomás Vicente. So I'm going to be checking. Tamara, no sé si encontraste el botón de breakout rooms y donde dice group 3. Tamara. Ahí está, ya se fue. Okay. Group 2.